Hello, I'm Tony DeMaria, the editor of JACC, here with Inside JACC to tell you about our March 20th issue and some of the really neat articles we have in that. And the first one I'd like to tell you about is actually a mini focus issue on optical coherence tomography, OCT. And this is clearly an exciting intravascular imaging technology that's gaining a lot of traction in clinical cardiology. And the first article in this mini focus actually deals with a set of standards for acquisition, measurement, and reporting of OCT studies. And this particular set of standards was developed by the working group, international working group on optical coherence tomography for validation and standardization. So we believe this will be an important document in detailing exactly how to do and report these studies. Now, from a clinical vantage point, there's a very interesting study by Alfonso and colleagues that deals with using OCT in coronary dissections. And they described some 16 patients in whom coronary dissections were suspected because of young patients with otherwise normal coronaries and suspicious angiographic findings in whom they did OCT and documented, in fact, that there was, in point of fact, a coronary dissection, spontaneous dissection. Interestingly, there rarely were intimal flaps, but they could see sometimes ulcerations. And the OCT was also very valuable in guiding the interventions in these spontaneous dissection patients. Another study dealt with a comparison of OCT and IVUS with fractional flow reserve measurements to assess the physiological severity of a lesion. And fractional flow reserve clearly was the winner. IVUS and OCT are not in a position to replace that. Finally, we have an editorial, I would say a very good editorial, prepared by Dr. Sam Samikas and myself on OCT, pointing out that it does have the potential for great clinical value, but that has to be established as we go forward. Another interesting study to tell you about is from the biomarker realm, and it deals with NGAL, neutrophil gelatinase associated lipocalin. And you know, NGAL has been used as a biomarker for renal disease for many years. And what this study did, and it came from UCSD, was looked at it as a marker for ultimate total mortality and particularly cardiovascular mortality. And they used the Rancho Bernardo study, which is like Framingham. It's a longitudinal study that's been done for over 20 years following an elderly patient here in the San Diego area. And the bottom line is that NGAL turned out to have about a 33% increase in risk for total mortality and cardiovascular mortality and combined events, and this was an independent risk factor over and above BNP and CRP. So NGAL may have some considerable potential in this regard and is worth keeping our eye on. For Inside JACC, I'm Tony DeMaria.